has a complaint or an issue, there's no triage going on. The person just goes out, and that doesn't necessarily have to be the case. It's great from our position because we know we can, at least some of that stuff can stay and wait until the next day and save the county some dollars. We would need the help. We legally, from a medical standpoint, we can't take, we're not going to be able to take information from a correctional officer. We would need an assessment from a nurse or somebody medical to give us some information on the phone so that the decision can be made. But that's exactly how a clinic works. I mean, when it's 10 o'clock at night and so-and-so's calling the call service, the secretary fields the call eventually goes to the nurse triages it. We do phone triage all the time. And then we have there are books written on how to triage over the phone, and then you make decisions on the information.
What is your backup if you're not available?
There is no backup. It's 24/7. It's him and me.
So when you're not available, you're on vacation somewhere, you're the one that gets calls.
Right. And if he has an issue, he calls me, even if I'm on vacation.
There will be somebody available 24/7. When you'll have our home numbers, our office numbers. I mean, if there's a problem, the superintendent can literally pick up the phone and say, "Chris, I need to talk to you."
And to answer that, honestly, if I really, truly, wanted to be on vacation without ever having a phone call, I just get one of my buddies as a doc to cover for me for the week and put him on the payroll. That's easy. That's not an issue.
In our, for using Rockingham, we were both there for a total of 3 years, and we provided 24/7 call coverage and medical care. We just rotate our time off.
You don't need vacation from a phone call. You can be on vacation and field a phone call very quickly. So in 5 years, I don't think I've ever had a vacation from the correctional aspects of medicine.
Space-wise, in our present facility?
Yeah, it's fine.
Adequate?
Absolutely. Actually, it's a wonderful facility.
It's a great facility.
Questions from anybody? Subcommittee chairman? Any questions? Go ahead, Mr. Babson. Representative Babson.
Just a quick one. In cutting your pharmaceutical costs, how do you two get the buying power to compete with some of the other majors that are in the field that will reduce your costs? Or are your cost reduction going to come strictly from generic type pharmaceuticals?
Both. I think the biggest cost savings is going to be using the generics, without a doubt. I think that when you talk about generics in general, most providers, who come into correctional facilities do a pretty good job writing for generics in regard to your basic stuff like your diabetics, but it's when you start dealing with the mental health issues, some of those drugs, new drugs, are extremely costly. I'm talking sometimes $200 a pill, extremely costly. And there's data out there in the medical community that the older generation mental health medications do the exact same job, that the newer ones are not any superior, and so the way, to be honest with you, all insurance companies do it, right? You have to create a formulary, and you create a formulary that is cost effective. We all have healthcare, and if you go to get a medicine, the first thing they're asking is...
Right now, we're not using formularies, right?
Correct.
Even your own insurance company, they're going to have Tier 1, Tier 2, Tier 3 drugs, and it gets more costly. So definitely using generics and having a tiered system is going to be the first thing we're going to attack. And then to answer the second part of your question, yes, absolutely, negotiating with vendors is another way to save some money. I think it's difficult for someone who doesn't have a medical background to negotiate with someone in the pharmaceutical industry about the cost of a particular drug. But that's going to be it's a lot more challenging for that individual to negotiate with Chris or I, because we know the cost and we know we can get it elsewhere for cheaper. And if you don't bend a little here, maybe we'll take our whole, we'll make a recommendation, take the business completely here. And you leverage yourself and you negotiate, and and try to get the best deal possible. But yes, you do it on both levels, both through a formulary and using generics, as well as trying to negotiate with these vendors for some of the drugs. So sometimes you're going to have to use some of the designer drugs. Some of the generics will fail, and you're going to have to go there. But when you go there, you hope that you can do it for the the cheapest way possible.
Thank you. Further questions?
Go ahead.
In your 3 years at Rockingham, I think you said it was, how many times did you get sued, and how did the cases come out?
At Rockingham, never. At Hillsborough, different environment, a little bit more litigious over there. As the physician, I always, even if it had nothing to do with me, I wound up in the courtroom.
Right.
I was in the courtroom 3 times in a period of a year. The first one was just to, almost like an expert witness for the county. That went in our favor. The other 2 times, they were frivolous cases. Both of them got thrown out.
And I had one at Hillsborough that was also thrown out as well.
Thank you.
Other than in the 13 years I've been practiced, I've never been sued. The only time was at Hillsborough. It was because of the population we're dealing with.
Yes, David.
Now, they said they had a la carte services. What would be the cost of simply negotiating drugs or setting up the formulary? I'm also kind of wondering, if, like Dorothy said, someone calls in the middle of the night, or the nurses calls and says, oh, we have an inmate turning green and wheezing, and you say it's X and it turns out to be something else. What happens? It sounds like, it kind of reminds me of Car Talk. The program on NPR, where they say, hey, there's something wrong with my car, it's making a noise, what's wrong with it, and the guys.
Welcome to medicine. That's my response to you. That's reality. I mean, we have, at Dartmouth, we've got 4 nurses in my department alone, who that's all they do all day long is field calls. And it hurts here, it hurts there, I've got this rash here. They've got to make decisions. They're not coming to us every second. They have nursing triage guidelines that guide them on what needs to be done based on the click or the bang and the rattle that they hear.
I just want to go through like a common scenario. Let's say that Chris or I on call, and we get a call that an inmate is having chest pain. So we need to assess that information with the data we have, and we just need to make a decision. I mean, if that gentleman is 20 years old and has no heart problems and no medical history, the likelihood that that's a significant coronary event is incredibly minimal, and it would be highly unlikely that that patient is going to be sent out. If it's a 52-year-old who has hypertension, diabetes, and history of heart disease, there's not anything that Chris or I can do, even if we came in. That patient needs access to appropriate medical care. So we're making that decision, and that's something that we've been both doing for, Chris has been practicing for 13 years, I've been practicing for 15 years, and that's something that we're very good at doing. End of the day, is medicine an exact science? Can you do that 10,000 times and one time not make the appropriate call? Absolutely.
Well, one thing just to follow up, I know the VA has video conferencing.
Mm-hmm.
And so that they can actually see the patient if they're sitting in Manchester and the patient's in Berlin or wherever. I think they have that service in Conway. Is that something that you're able to do, or could we upgrade to that so
I think
you can see the person?
Yeah, no, we've thought a lot about that, video teleconferencing for a portion of the medical care. I think that's difficult to do when you're talking about medicine. I think with mental health issues, that's certainly easy to do. The concern comes is, will the medical board allow that? And now I can tell you, Prime Care was doing that. They were doing the psychiatrists were sitting in Pennsylvania, and they were video teleconferencing the interview, and decisions would be made. I was a former military physician, and they did that all the time. Dermatology did that. The radiology does that. So there are definitely certain fields that do that, but that's something we would take on head on if we could do that, because it'd be much easier to get psychiatric services if I didn't have to recruit someone to travel, 2 hours to come here to do half a day of service. I mean, if I could, if we could set them up with a video teleconference, it's much easier to attract someone. It could be done. It's just we'd have to get and I welcome it. We would welcome it, but we need the you know, you need the okay of the state medical board. And then to, you know, with mental health issues too, I mean, we do 90% of it. You know, Hillsborough County averages about 650 to 700 inmates on average. Well, we took care of 90% of the medical issues. We had our psychiatrist come in 2 hours a week, so 8 hours of service a month for a facility, I don't know, almost 15 times the size. So I feel pretty comfortable saying that, you know, we would need the aid of a psychiatrist, there's no doubt, but it's not going to be a very frequent occurrence.
Because we're such a small facility, why would you be interested in doing what you do for us?
It's America. We want to be in business for ourselves, and that becomes much more challenging in today's society. You know, you got to work for big organizations like Dartmouth. It's very challenging. You know, you have to be innovative if you want to be in business for yourself in the medical field these days. It's not like it was 30, 40 years ago.
When you say that you would engage a psychiatrist,
Mm-hmm.
is that within the parameters of this contract?
No. We would if that was requested. We could put it into the contract, but we'd have to, that was, you know, it's not a, we could work to get a psychiatrist. If you wanted us to get a psychiatrist, we'd work to get that. And we could put it into the contract.
At an additional cost?
Of course.
The one thing I want to point out about that, you know, that number that we're proposing, a fairly large portion of that is directly medical liability, malpractice insurance. It's incredibly
Expensive.
difficult to get medical practice. It's over 20% of that fee.
Yeah, our cost right up front's 10 grand on medical just to do a part-time gig. It's insane.
Yes, Dominic?
Yes, on the law enforcement emergency room transporting overnight issue, is there currently a nurse on call or?
For our facility? No.
So I think you would at least have to do that, if not put a nurse in overnight so that she could diagnose to call them. Otherwise, I don't see it cutting down the emergency room visits at all.
Right, you just send them.
You certainly, you don't have to have them in-house. You know, at Rockingham, they did have the 20-foot, but it's a small enough facility that I think you probably could get away with, just like we're on pager, if a nurse is on, you know, got a pager, if you get a phone call, if they live nearby, they can come in, do a quick assessment. Huh?
There were lots of ifs there.
Well, the ideal...
You could, I mean, you could hire someone to come in for, you know, a 2-hour period, assess the patient and leave. I mean, that's a cost effective.
The ideal situation, as I would see it, is we have RNs at our nursing home,
That's right.
which is
Right, yeah.
just a building away. Ideally, if we could find an RN that would service those special calls, would be the ideal situation. The problem is, we have problems with RNs or nurses in general working in the nursing home and the jail. But ideally, that would be the
And
thing to do.
if there's a big issue there, I mean, that, again, that's something we're willing to provide. If you want us to find, you know, a nurse that's willing to work on call for a fee and to assess a patient if called, we'll find it.
But I agree that in
That's
that
not-
situation, having somebody literally, you know, 2 buildings away, you know, that would, you know, potentially getting that. Unfortunately for all medical providers, and I'll share that same experience, you know, when I was practicing my office and, you know, I had a nurse approach me, she was looking for somebody to provide medical care, the first thing you hear is jail, and you go, oh, you know, now I'm not even going to talk to you about that, and there's that initial, you know, fear, but it really is not any different, you know, working in that nursing home and assessing a patient versus assessing that patient in jail.
Yeah.
It's just giving that nurse, and that nurse becoming comfortable with her medical staff, and, you know, if there's deficiencies and she has certain things that she needs to learn, then, you know, we